Happy day! Are you a brand new insurance agent or a veteran insurance agent diving into Medicare and you realize that it's all done in code? I'm going to go over the secret codes of Medicare. They're not so secret, but a lot of agents don't fully grasp them. So I'm going to go through these codes one by one to help you understand what they mean to you as well as your client. So before I get going into this, the secret codes of Medicare, JasonFinalExpense.com. I'm so blessed and privileged to partner together with some amazing agents across this nation to sell Medicare insurance and life insurance face-to-face and over the phone in the telespace. If you need help, reach out. We'll serve you in any way that we can. But let me tell you, when you first dive into Medicare, it's confusing as all get out, right? So I'm going to go through some of these little acronyms, the little secret codes to help you hopefully have a clearer understanding of what they mean. So the first one I want to go through with you is AEP, right? AEP. And you're going, what does that mean to me? AEP just stands for Annual Enrollment Period. This is the time where people can get on their Medicare plan once a year. It's called the Annual Enrollment Period. That's the AE and the P. All right. Another one is ROY, like Roy, okay? He's not your neighbor, Roy. Roy means rest of year, okay? Rest of year. If you heard the term SEP, SEP just stands for Special Enrollment Period. The SEP is very good to know when you're doing certain Medicare insurance plans, if you're doing the AHIP, you're doing Medicare Advantage or drug plans, because the SEP can allow them to move around at different times that they otherwise couldn't. So SEP is kind of cool. You want to know these terms and what they mean to you, but the SEP, the SEP, okay, is Special Enrollment Period. The SAR, the SAR, okay, it's not a disease, it's not a virus or anything crazy. The SAR just stands for Service Area Reduction, okay? That's what that stands for. AHIP, hello, you got to get the AHIP before you go doing half this stuff, unless you're just doing Medicare supplement insurance. If you're just going to sell Medicare supplement insurance, you do not need this AHIP stuff. You just don't. You can just go sell supplements all day long as you hold a health license. So you got your life license, you also need to have your health license ready to go too. So little nugget for you. But AHIP just stands for America's Health Insurance Plans. AHIP, right? Nice and easy. LIS, right? LIS. LIS just stands for Limited Income Subsidy, okay? Limited Income Subsidy. And people that are LIS, they can get some help in paying for their plans. Kind of cool. But LIS is a good thing to know. You want to know what LIS means to you and means to the client. MAPD. Everybody's heard of MAPDs, right? You're like, woo, need that renewal money. Well, MAPD just stands for Medicare Advantage with a drug plan, a RX plan. So that's what MAPD means. If you're dealing with a DSNP, right? Sounds weird. That just means Dual Special Needs Plan. So the code word here, when you hear the term DSNP, that just means Dual Special Needs Plan, typically like a Medicaid kind of a person. A CSNP, a CSNP, is a Chronic Special Needs Plan. So kind of similar but different, okay? CSNP is a Chronic Special Needs Plan. A PDP, okay, we're going to talk about that a little bit for you Medicare agents out there. PDP just means Prescription Drug Plan. Medicare supplements are just for doctors and hospitals. It's just covering Part A and Part B of their medical. No drug coverage whatsoever. So people that have Medicare supplements are going to need a good drug plan. That is what they call a PDP. It's a standalone drug plan, just a prescription drug plan. It is not a MAPD, which is Medicare Advantage, which allows them like doctors, hospitals, and drugs all like spun into one. So a PDP is definitely what your Medicare supplement people are going to really need. You got to make sure that you're ready to go. So go get your AHIP so you can get this stuff done, okay? In HMO, okay? And HMO just stands for Health Maintenance Organization. This is like your Kaisers of the world, your group healths of the world. There's a lot of, businesses out there, insurance, okay, companies that do HMO, where it's a health maintenance organization. You've got to stay within their little circle for the most part, unless it's like life-threatening and emergency-based care. Then you can go and get typically out of network, but only if it's life-threatening. And then when you go back to the normal stuff, like a routine surgery or any of that kind of stuff, it's got to be under their wall. So always, if you're selling HMOs, read the fine print before you sell that stuff. Okay. PPO. You've heard the term PPO. You probably know this as a younger agent, right? PPO is just Preferred Provider Organization, Preferred Provider Organization, or PPO. So I hope this is helping you guys. We're going to dive into more as we keep going, but I hope this is helping you. Another term we're going to talk about is PFFS. Okay, PFS. Okay, the PFFS here just means Private Fee for Service. So when you have certain medical plans, it could be a private fee for service plan, PFFS plan, or it could be an HMO, health, okay, maintenance organization, or it could be a PPO, preferred provider organization as well. These are kind of the code words that I'll go over with you, and then I'm going to recap it as well. In SOA, you're like, what's a SOA, right? Scope of appointment. SOA is just scope of appointment. That's all, okay? Nothing to be afraid of. If you've heard the term EAP, what in the world's an EAP? Okay, I took my vitamin E and D. What's an EAP? An EAP just stands for electronic application. Nothing more, nothing less. Super simple. If you hear the term like hospital indemnity plan, they call them HIPs sometimes, okay, or an HI, it just means hospital indemnity. These are beautiful for people that have a Medicare Advantage plan, or maybe they're on like a plan in Medicare Supplement or some other plan that's got a big copay when you go into the hospital or to their doctor. A hospital indemnity plan or an indemnity plan in general could pay that client kind of like, you know, other companies would pay them on an indemnity basis, okay? So if I go to the hospital, you write me a check for that amount. That's an indemnity type plan. When this happens, they get paid to help offset their cost. So hospital indemnities, HIs or HIPs, hospital indemnity plan, really nice to have. A lot of people call them HIPs or a HI, an HI, hospital indemnity type product. Another little code word is CMS, right? What in the world is a CMS, okay, plan? That just means Center for Medicare Medicaid Services. So CMS, Center for Medicare Medicaid Services. Now, if you in the terms, okay, if you doing your good work out there in the field, helping good people, you ever hear the word POA. What in the world's a POA? That just means power of attorney. Now, you want to make sure, is this power of attorney enacted, or is it like something that just sits on the side until they're incapable of making decisions on their own? You want to make sure that you're talking to a true decision maker. So if you're talking to somebody that has given away their authority to make decisions, they have a POA that's active, you can't be really doing anything anyway. You're talking to the wrong person. You're talking to a person that doesn't have the ability to actually execute on all that time that you're putting into trying to serve them. You're talking to the wrong person because they don't have the key to the lock, okay? So if someone says, I've got a POA, and you got to talk to them, if it's enacted, there you go. You're going to want to know what a POA means, which is power of attorney. That person you're talking to does not hold the power if their POA is the one that's holding the keys. So if you hear the term HIPAA, HIPAA, Health Insurance Portability and Accountability Act, HIPAA is a big deal. You want to make sure that you're abiding by HIPAA, keep everybody's information secure, keep it locked down, keep it clean and mean. So HIPAA, very important, keep things secure. You wouldn't want someone sharing your junk all over the planet. Don't share anybody else's stuff. It's your career on the line if you do, so just don't do that. But HIPAA, very important. Health Insurance Portability and Accountability Act. That's what it stands for. So another term, if you've heard the term MOOP, what's your MOOP? Like, what in the world? MOOP? Are you kidding me? What a weird thing. Okay, it sounds like something that should be done in a bathroom somewhere. But MOOP just stands for Maximum Out of Pocket. So MOOP just stands for Maximum Out of Pocket. I hope this is serving you. It's weird code words, right? But I hope this is giving you some clarity if you're brand new. So MOOP just means Maximum Out of Pocket, the MOOP. If you hear the word troop, okay, it's not a bunch of good soldiers, okay? It's not a Boy Scout troop or a military troop or some colonial day troop out there. What troop stands for, okay, it just means true out of pocket. True out of pocket. That's what troop means. So when you're dealing with that, that's what it means. If you hear the word ACA, you've heard the term ACA, that just stands for Affordable Care Act. That's what ACA is. If you hear the word MACRA, okay? Medicare Access and Chip Reauthorization Act, okay? Fun stuff. But these are just some acronyms that'll help you. So AEP, Annual Enrollment Period, ROY, Rest of Year, SEP is Special Enrollment Period, IEP is Initial Election Period, okay? SAR, Service Area Reduction, AHIP, let's recap, is America's Health Insurance Plans. LIS, the list, okay, is Limited Income Subsidy. MAPD, Medicare Advantage Plans with an RX, okay, it's got drug coverage intertwined. And FMO, okay, it's places that are a field marketing organization helping you to help others. That's what it is, okay? If you're focusing on a DSNP though, a DSNP is Dual Special Needs Plan, okay? Dual Special Needs Plan, they call them DSNPs, okay? A CSNP, Chronic Special Needs Plan. A PDP, okay, PDP, okay, lots of fun. Prescription Drug Plan, have some fun with it as you're learning, okay? Doesn't have to be all boring, right? HMO, Health Maintenance Organization, to recap. PPO, okay, Preferred Provider Organization. PFFS, okay, Private Fee for Service. SOA, okay, Scope of Appointment, okay? An e-app just means an electronic application. It's not telephonic, okay? It's electronic. Maybe they're signing, okay? Because you're in the home typically. A HIP, Hospital Indemnity Plan, or a HIE, which is just Hospital Indemnity. It can be either, okay? CMS, Center for Medicare Medicaid Services. POA, Power of Attorney. And HIPAA, Health Insurance Portability and Accountability Act. So there you go. That's just kind of like some secret code language of Medicare, how it works, how it shakes, so that you can understand these stupid words, but yet they're not. These little code words mean something great for you if you're a Medicare insurance agent. And I know a lot of times it's easy to get confused by them because it's like somebody speaking pig Latin on you. It's like, oh, they're an LIS, they're a DSNP, they're a MACRA, there's what is going on here? Okay, it's crazy. So I hope this helps you. If you need some help, give me a shout, jasonfinalexpense.com. I can give you, okay, a doc that will help you understand some of these acronyms as well. Love to serve you. I appreciate you watching, and I hope this content helps you today to understand the little secret language of Medicare, and now you know the codes. They can't talk pig Latin on you, okay, like when you were kids and somebody's, speaking, okay, it's like, what did you just say? Well, if you know pig Latin, you know exactly what I just said there, okay? So now you know the code, so nobody can, okay, say something to you without you having knowledge and power to bring the client value. And you as an agent hopefully will gain more certainty as a result of knowing what to say, knowing what these weird things like throop and moop, okay, mean now. So I hope this silly video finds you well. I hope it serves you. Having a great day, have a better tomorrow, and be ready and prepared to take care of good people. They need you, and they need us to be better educated as a result. Have a great day. I appreciate you guys.